Well, welcome again to another episode of Enrichment on the Go. And today, Miss Keyanna and I are going to be talking about best practices for potty training your child.
Hello, everyone.
Dun, dun, dun.
I'm excited.
Potty training. The quest to get your child to go to the bathroom on their own. It is a journey that you will take for quite some time, and you need to pack on your patience, parents. So get your book bag, your backpack that says labeled patience, and let's dive into potty training, all right? So we're going to be discussing the best practices for potty training. And some questions that we've heard are, what age is best to start potty training? That is a loaded question because some people, think one is the time to potty train. Often in my tenure as a provider, as a parent, I'm going to speak from both perspectives with this. I honestly would say about 18 months to 2 is a good time to start. It depends on the child. It really depends on the child. All right. And so what you never want to do is force a child to just sit on the potty for 30, 40, 50 minutes. Okay. Because that is not developmentally appropriate. It could, once you start getting into 30, anything beyond, to me, 10, 15 minutes is almost, could be considered almost like child abuse, really, because the child is just sitting there. Now, I want to give you a scenario. As an adult, what's the first thing you do when you get up in the morning? Use the bathroom, right? So, parents, when your child first gets up in the morning, you can't rush. You have to allot time and put them on the potty because they're going to go.
No, they are.
They're going to go, right? And so you go, they're going to go. So that's a perfect time. And then, right, if you haven't eaten anything, you get what? If you don't eat or drink anything for a certain amount of time, do you go to the bathroom like that? No, right? Nope. And you may even become dehydrated, right? Depending. And so what you want to do is normally, depending on, watch your child's pattern. It's very important to observe your child, right? So,
observe their routine.
Observe your routine. So if you feed them breakfast and maybe 20 minutes later, you notice, remember, every time, or you're on your way, every 20 minutes after they eat, you notice they're in the corner or they have had a BM. Well, that would be a good time. Right after they eat, maybe 10 minutes later, put them on the potty, right? And then it's pretty much about every 2 hours from there. Often you'll see where children will urinate in the potty before they do a BM in the potty. That's normally what happens. They'll urinate before they do a BM. And sometimes they'll urinate and then they won't have a BM for months on end before they actually have one in the potty. I remember when my oldest son was very young. Oh my goodness. And he was eating. And I was probably a little bit of authoritative parent at that point because I was told, I didn't know. I was told, this is before I got into the field. Oh, by 2 or 3, they should be going. No, they should be going. Well, how can I control that? The child is the only one that can control when they go to the restroom. And so I was authoritative in the fact that my husband and I we were like, no, you need to go. You should have did it on the pot, and that did not work. Okay. It didn't work. And so what we had to do was change the way we were approaching him. Okay. So we couldn't yell or we couldn't say, no, you almost a scolding, because if they feel like they're being scolded for going, think about that. Going, you have to go to the bathroom, and then you're scolding me because I went on myself. I'm not going.
Right.
And that's what happened with him. It was about a week. He had not had a BM. And I called Children's Hospital Hotline, and I said, my son is not, I'm concerned. I think I'm going to have to bring him in. He has not had a BM. And they said, is he passing gas? I said, yes. She said, ma'am, that's the only thing he can control in his life. And I didn't think about it like that. So parents, I really want you to be,
creating a space where they're comfortable.
Create a space where they're comfortable, right?
You got to start there first.
Right. And just because they go one time or two times in the pot does not mean that they have mastered the skill.
Oh, yeah, absolutely.
Right? They may go, or maybe they can control it. They're okay when they're going throughout the day. But when they take a nap, they can't control it. They're very tired.
Yeah, it's a process. It's gonna have some hiccups. And I think that also just like creating I say creating like an environment where they feel comfortable, but also like, I guess like making it like fun for them.
Absolutely.
Or like
we're gonna talk about that.
Making them want to do it, because the purpose of potty training is I'm training you to go to the potty by yourself. So it's like I'm training you how to do this by yourself.
I think that's good.
Yeah.
And one thing like we've done, even if we go to put them on, maybe they're 2.5, and they can help pull down their pants. They can help pull down their underwear. Maybe they can help pull it up. Maybe they did not go they didn't use the pot or the toilet, but they were able to pull their pants down. That's still a skill that goes along with potty training.
Absolutely.
So you give them kudos for the parts that they've done. Okay, you tried.
Rewards.
And we're going to talk about rewards. Because let's go to that. So tools to use with potty training. Stickers. I don't know a child that does not like a sticker.
Right?
A sticker or a stamp that you can get from the dollar store.
Yes.
They love stickers. Children love stickers. So if you put up a nice, you use your creativity, parents. And if you don't have much, go on. You can do so many things. You can put up a poster board, and this is your potty sticker wall, right? And then, hey, okay, let's see. Can you pull down your pants? Awesome, great job. All right, it's time to sit on the pot. You want to grab a book, and what I'm saying is, you can put a little basket,
just
near the toilet, and it can be vinyl books that you can wipe off. You want something, or a hard book that you can wipe. You don't want books with soft pages, because again, you have to be careful of germs and things of that nature. But you want vinyl books or hard books that you can take a Lysol wipe and wipe it off.
Or like have them sometimes people purchase the potties, like have one that's their favorite character, or have one of those their seats, so they're like, oh, that's mine. Like that's, so they are actually excited to use one of their toys, but it's a potty training toy.
And you can get a book. Your local library is always a great resource, because what you're doing and what you can do is build vocabulary even while they're going to the restroom. So often
sing a song.
Oh, songs are
amazing.
Everything. Songs to a child.
Sing a song.
And you can make up a song, and you insert your child's name.
Yes.
Oh man, you're the best. You're the best parent ever.
Award-winning, Grammy nominated
by your child.
Yes.
If nobody else gives you a Grammy, your child is giving you a Grammy with that smile that they give you, right? And so make up a song. Potty time. I love to make up songs. So potty time is potty time. Potty time. It can be simple as that. It doesn't have to be.
And they'll love it.
They will love it, and they will love you, and they will love potty time.
Yes.
So you want to do that. Even if they want to put stickers all over their own potty. Listen, they can personalize their potty.
Personalize your potty. Yeah, that's a good one. I like that. Personalize their potty.
Yes, they can personalize their potty. So you want to use positive affirmations, okay? Even if you see that the child has been going for quite some time and then they have an accident on themselves and you see them in the corner. I've seen this so many times with a toddler. They're peeking around the corner because they're actually over there going. If they're standing really still, that's usually a total indication. So if you can say, come on, let's get to the pot. You may have to pick them up. Don't expect them to walk in there in the middle of a BM. It's not happening. Do you do that? No. All right. So don't expect that from your child, but you could actually take them and try to catch. You may catch in between.
Yeah. Oh my goodness, putting on clothes that they can actually know how to take off themselves so they can get to the potty on time.
That's a big one.
Sorry, so that was a little triggering because I remember you can't even undo this belt that you got on this little jumpsuit.
It's fancy.
Yes, it's cute, girl, but this is not potty training appropriate.
Now that's a good point because you want to make sure that it's something that the caregiver or yourself as the parent can get down.
Yeah.
Because if it's the jumper and it zips in the back and you've got to literally strip them to get their outfit off. It's a process. It's a process. Think about when I've worn a jumper before and had to go to the restroom. And it's not cool.
You're struggling. And it's oh my goodness.
And you make sure you go to the restroom before you go to the
event. Yes. You have to plan out your potties because you don't want to be in there trying to,
And you have to go with the girlfriend so they can zip you back up after you're done.
Yes.
So it's
potty training appropriate clothing. Please.
I think that was good because that's not something that I actually had in my notes, but I mean. That is amazing.
Yeah.
You do want to make sure that it's appropriate clothing for them to go to the bathroom.
Oh, you couldn't get your belt undone?
No.
Of course you couldn't get this belt loop that's tied into this other loop.
And think about that because the teachers and some centers their policy is that they don't touch the child, especially in the public schools.
Oh, absolutely.
You aren't allowed to touch the child when they have to go to the restroom. So you parents, we have to make sure, that's one thing I did all the time. Make sure that buckle, and work with your child on buckling. But if they are trying to get through this skill set of potty training, or going to the restroom. And a lot of times when children are playing, they're very excited. So they don't want to stop
thinking
playing.
About. Yeah, they're like,
So it's the last minute and it's like, I gotta go.
I was having so much fun.
This is a hiccup in the program.
Yeah.
And so you want to make sure that there are items that they can get down and up quickly. And should your child wear pull-ups? Well, most of the time in a center or a child care setting, they're going to want your child to wear a pull-up. If your child is at home and you're potty training and you want to do underwear, I think that's great. If your child's ready, I just say don't force it because again, this is a skill that they have to learn. And so it may be where you can have the underwear. They have the thick underwear. They have underwear with the plastic in it. Some, developmentally, you want to make sure your child's comfortable, right? And so if it's going to make where the child is urinating all over the place, and they're not there, or you've given them a lot of liquids, they had their little kidneys, have had a 6-ounce pouch of Capri Sun or Kool-Aid Jammer, right? 6.75 to be exact. I know, right? 6.75 ounces goodness. In their little 3-year-old bladder. Okay.
That is a fact that only a center director would know.
Thank you.
I just want to let you know that because no one else is going to know how many ounces
are in
that juice.
6.75. And then they come in and they eat. and then we give them a little bit of juice. And so now or because they have had so much juice, they don't even eat.
Mm-hmm.
Okay. So you have to really think about those things. That's not really made for a child who's 2 or 3.
Yeah.
You know,
and I learned this from you. Just if they aren't, comfortable yet, modeling to ask for the pot, like getting them to that point. But also, if you want to just get them in the routine of actually wearing underwear, you put the pull up and you put the underwear. Yeah. I was about to say, you taught me that. Yeah, you put the underwear on top of the pull up. Mm-hmm. So it's like, if they do have an accident, you are there to clean up that pull up. But those because the underwear is eventually what they're gonna wear. Mm-hmm. So it's like you're wearing these underwear, but you also have that protection. So if you do make a mistake and things like that, it's also showing them like the routine of it. Yeah, like you still have to pull down your underwear. Same vocabulary words. Pull down your underwear. Like did you go to the bathroom in your pull up, and ask them like that. But I think that's a good idea too, as far as when they should stop wearing pull-ups, like when they get to the point when they are ready. Absolutely. And I think that's a hard time too. And I think that's like a just like something that sometimes like parents they'll like read stuff that's like, oh, by the age of 2, your child should be, here and there. But like just respond to their needs. Like when your child gets to the place where they're ready. And because I know I don't feel like changing underwear all day. It's true. Yeah, so it's just like, and if they keep messing up over and over and over again, that's the positive reinforcement. Yeah, like that's going to like hurt their confidence in wanting to keep trying. That's good. Keep trying. That's a great point. Often we stop after about the second change of clothing. If they're in underwear and they're in the second pair of clothing that they've wet up, okay, you've tried for today, and so now we're going to put the pull up on for the rest of the day. You're fine, it's okay, because you do want them to have the confidence to go on with it, because if they really could feel like they're failing. Yeah, they could. But it's like, and so this like, okay, yes, I do have my pull up on, but I also have my underwear on. So it's like, I'm still working on it. Absolutely. And I think, like one day you are not going to wear this pull up anymore. I like that. Yeah. I like that. And that's something that they can say to them. Yeah, absolutely. One day you're, and even with the books that you get, and that's what I love what you were mentioning about the vocabulary. Okay. Instead of potty, let's go to the toilet. Let's go to the restroom. We interchange bathroom and restroom here. Instead of, okay, it's time to go to the potty. Sometimes we'll say that. And I have seen where the potty watches work. Sometimes, not all the time, but sometimes. And often when they see other children going, then they'll go, right? There's some very clean videos on YouTube that you could watch with your child about potty training, cartoons that will let them know that it's okay, because it's I like this too, the positive affirmations. Like before you walk in here, I am going in the potty. I am going in the he's got to go to the potty. Go to the potty, and I'll tell them, sometimes I'll even say, okay, say bye-bye, say bye-bye, flush it. Yes, that's the part of making it fun too. It is, and they have to learn to wipe themselves, because all of that goes with toilet training. Yes. So not a BM, but you start out, teaching them to wipe themselves, little boys and little girls, to wipe themselves properly. And help them. Yeah, because it's more than just going in the toilet. It's actually like, maybe it's putting the toilet seat down maybe it's flushing the toilet. And depending on the age of the child, now you need to wipe the toilet seat off. If it's a little boy, let's wipe the toilet seat off, put the tissue in. I don't touch it. I guide the hand. And then, okay, now let's flush the toilet. Because all of that goes with toilet training. Yeah, now that would be once they're a little older developmentally, but all of that goes with it.
And now you have to wash your hands. You never leave the restroom without washing your hands. And I love parents, you sing an ABC song with them, sing the ABCs, something of that nature, but you really want to make it where it's engaging the child. It's still learning.
It is, absolutely.
I think we have to understand, even with diapering, it's still learning. You're still teaching them, oh, you went to the restroom, or something of that nature. But oftentimes, and give the child their space during that time. Don't kind of hover.
Yeah, but let them know what's going on.
Yeah,
I think that's important
that's
too.
Good. That's
good. Even sometimes sometimes when you're changing a baby, you're telling them I'm going to change your diaper, let me wipe, and you're telling them what's going on.
Yes,
they know too.
And I think that's good for parents with younger children, even though this is about potty training. It all leads up to that. So with diapering, you want to let them know this may be a little cold, or give me one moment. I know you don't like that. Okay, one moment, let me wipe you up. Or you want to have as many conversations and communicate, because again, it's their body.
Yeah, that's their body. And in our classroom, there's a little video that we show in our curriculum, and it calls it a no-no spot. So it's when we're teaching, because sometimes when kids are playing and they touch each other, sometimes they don't realize how they're touching. Some children do, unfortunately. So it's telling them, this is a spot that mommy's touching,
right?
And
no one else
this is why I'm doing it, as your caregiver, because I think that's important too.
We do that, and I'll say, can I wipe you now? Or okay, let me help you. Yeah. Sometimes I'll say, let me help you. I'm going to, so
don't just touch them.
Right. They have to feel safe during that process, and so these are positive things that you can do, parents, because we want to encourage you. And again, we want you to know that whomever's working with your child, that you all are working together as a unit. And you're going to hear me say that quite often, because that's what we're doing. So the best times to have your child to go, remember, when they wake up in the morning, right? And maybe 20 minutes to 30 minutes after they eat, depending. And it can be, most people go to the bathroom every 2 to 3 hours, right? So you could sit them on the potty every 2 to 3 hours. I don't honestly suggest waking them up during the night to go, but if you choose to, you can do that, depending on where they are in the process, because you get up sometimes and go to the restroom. But if you limit the time frame in which you give them something to drink before they go to bed, often they can last through the night. So you want to limit, maybe if they go to bed by 9, you want to cut all the liquids by 7:30. Okay, so they can go to the bathroom right before they go to bed, and then by the time they wake up in the morning, they're ready.
That's good.
So thank you all for tuning in, and we hope that we've helped you with best practices for potty training your child.